Among men, there is a common belief that when problems with erection arise, the best way to get rid of them is to take various kinds of medications. And that's exactly what advertisements suggest. But when taking these medications, the situation does not improve in the long term. I'm Dr. Vasil Tchaika, and today we'll talk about why erectile problems really occur and what you can do to avoid taking medications and have erections like you did at 20. According to statistics, erectile dysfunction at the age of 35 to 40 is experienced by 40% of men. According to the same statistics, by the time you reach 50, half of all men have erectile dysfunction. If you are already 70, then 70% of men who have reached this age have erectile dysfunction. And according to the latest data, even among young people aged 18 to 20, erectile dysfunction already affects 30 to 35%. And the cause of this problem lies not only in the fact that you supposedly lack testosterone, or because you eat improperly, or you have some other accompanying illnesses. There are actually only two problems behind it all. The first is physical, which is related to the muscles and other organs involved in achieving erection, as well as the emotional component. But what is important? It's important not to panic right away. Just because erectile dysfunction has occurred, it doesn't mean that's it, that it's for life, and as they say, there's no way out. If you know why it develops and use simple approaches, erectile dysfunction can be overcome. Let's first go over the causes, and then we'll discuss what needs to be done. So, on a physical level, the mechanism called erection, that is, the enlargement and lifting of the penis, happens first due to blood filling it, and then due to muscle contraction. A common mistake is that often men and women believe that it is the tension of the muscles that causes an erection. No. First, the corpora cavernosa relax, increasing blood flow. Then the muscles contract, disrupting the outflow. That is, conditions are created to impede the outflow, and only then does what is called an erection occur. Therefore, on the physical level, when we have problems with the lumbar region of the spine, specifically the lower part. When it comes to L5S1, the sacral region, and the coccygeal region, these areas, it's precisely from there that the innervation of the pelvic floor muscles originates, including those involved in erection, and this is where dysfunctions can occur. The dysfunction is specifically that the penis fills with blood, but the mechanism for lifting it, for erection, does not occur. And so it seems like everything is fine. The man comes to the woman, the moment arrives, but nothing happens. It just doesn't work. And so, in this case, the simplest solution is always to seek help. This means addressing the primary spinal disease and muscle problems. But aside from mechanical issues, there is also an emotional component. What is the essence of this? After all, we're told that if your body doesn't produce testosterone, that's it. You have to take it externally. But what is testosterone? And when exactly is it produced? And how is this process controlled? Of course, all of this happens thanks to the control of our brain. And the control center for the state we call an erection is located right here in the right area, practically behind the ear in the brain matter. If a situation arises in our life that we perceive as stress or anxiety, in other words, anything that leads to the activation of the sympathetic nervous system, there will be no erection. This state is made worse if, for example, a woman says certain things about a man's erectile function, or if the man himself perceives the situation differently. He expected one thing, but it turned out another way, or perhaps there was no so-called masterclass demonstration or something else related to this. All of this will further activate the sympathetic nervous system, making an erection impossible. Because remember, I was talking about the physical level. The corpora cavernosa fill with blood, but first the parasympathetic nervous system must be activated. In other words, a man must first relax. Only after that will an erection occur. And if he is in any state of stress, it doesn't matter what changes happen at the muscle level. An erection will not occur. So let's move on to what needs to be done, how to help yourself. All right, so if we move on to the physical, thank you. When it comes to the physical component, of course, we need to address issues at the lumbar, sacral, and coccygeal sections of the spine, because it is from these areas that innervation originates. So, if you find yourself in such a situation, you can, for example, consult an osteopath or a vertebrologist. And if it really is related to an issue in the lumbar, coccygeal, or sacral sections of the spine, then after just one session, your erection will be just fine. After that, all you'll need to do is maintain your muscles in the proper tone, as they say. To do this, you can also use some very simple daily procedures. So first, we can train the pelvic floor muscles. This is done very easily and simply, and you don't even need to set aside special time for it, as they say. You can do this exercise anywhere, and no one will even notice. The essence of the exercise is very simple. You just need to tense and relax your pelvic floor muscles. How do you do this? When you go to the bathroom and the last drops of urine are coming out of your bladder, the movement you make to squeeze them out, that movement is what is called contracting the pelvic floor muscles. And in the area between the penis and the anus, this perineum contracts. So by consciously training this movement, by intentionally contracting it, you exercise it. Let's try it now so it's clearer. So we contract as if we are squeezing out the last drops from the bladder. Hold for 2 seconds, then relax for 2 seconds. Again, contract for 2 seconds, relax for 2 seconds. And like this, we can do up to 10 to 12 repetitions. Then we increase it, meaning we contract for up to 5 seconds and relax for 5 seconds. And you can repeat this 2, 3, or even 4 times a day. And that's enough. I can also add that even women who have problems with urinary incontinence can use this exercise and it will help them as well. Additionally, we also need to completely relax the muscles so that the nerves running from the spine directly to the muscles that innervate the penis and its areas do not go into spasm. In other words, this prevents what is known as tunnel syndrome from occurring. So which muscles do we need to relax? These are the gluteal muscles. That's why we can relax the gluteal muscles in various ways. This could be, for example, different types of massage. The most important thing is that you are able to find the painful spot that appears there and eliminate it. The simplest way to do this is, for example, with this kind of vibrating massager. When you turn it on like this and search on the gluteal area for a painful spot, for example, you place it there, a vibrating motion occurs, and you wait until the pain disappears. And in this way, you work through the entire gluteal area. Also, if you don't have such a device, you can use a regular tennis ball and, for example, find a painful spot on the gluteal area, place the ball there, and, for instance, lie down on the floor and carefully work through the painful area with your glute by gently moving over it until the pain completely disappears. That is, when the pain completely disappears, the muscle relaxes, and this leads to the nerve no longer being pinched by the muscle. So, on the physical level, this is sufficient. This allows our muscles to function well, and essentially all parts of the system to perform their intended function. Now let's move on to the emotional component. So what should we do now on the emotional level? Here, for example, if a situation arises where, say, a man realizes he's getting older and, for instance, his morning erections aren't the same, meaning he's worried about the mechanism and frequency of these erections, then, in this case, it's important to reduce the significance of the issue. What does that mean? First, you need to clearly understand that, biologically, the purpose of an erection is simply to deliver sperm into the vagina so that it can reach the uterine cavity. Fertilization has occurred. So in fact, if you have 1, 2, 3 or even more children, you are already a super male. From a biological standpoint, you have already continued your lineage. You have fulfilled your function here. So you are a super male. I emphasize this again. You can praise yourself and not pay any attention to that erection at all, because biologically, you no longer need it. Remember, from a biological perspective, animals don't think about giving pleasure, whether they have an erection or not. They think about continuing their species. So if you already have children, everything is perfectly fine with you, and your erection is exactly as it should be from a biological point of view. But sometimes this doesn't help, because the reason, for example, is that a man wants it because society imposes the idea that it should be this way, that a woman must be satisfied. After all, that's what is constantly shown in all kinds of movies and in the information that, as they say, is spread on the internet. And then, in this case, it's very difficult for the man to cope on his own. And here, a woman can come to the rescue. She can simply praise him for certain actions and so on. That is, a woman's praise, specifically as a female affirming that he is a male, can also significantly help. Thank you. Improve the situation. Not, oh, nothing worked out today, what's wrong with you? But rather hug him, kiss him, help him relax. Please remember that on the emotional level, the cause is always the activation of the sympathetic nervous system. And if he even slightly fails, it activates the sympathetic nervous system even more, and that's why an erection occurs. So, dear women, remember, hitting him with a frying pan and yelling that he has to satisfy you, as they say, to make sure he has an erection, that won't work at all. He'll have to look for another woman then. That's why praise and acceptance are what really help. And the last point regarding the emotional component, when it's not related to the family, but rather to other emotional experiences, for example, work, business, or certain relationships with friends, and so on. In those cases, you should always try to resolve the situation decisively. If that's not possible, for example, to leave that job, change jobs, move to another place, and so on. If that's not possible, then the next option is to reduce its significance. You need to shift down to the biological level. What does the biological level mean? This situation threatens your biological survival. After all, your only goal is to continue your lineage. So for example, if you don't have money or, I don't know, your business went bankrupt or a friend got into a fight with you in some inappropriate way and so on, does that really equal death, actual physical death? And in order to, as they say, make it easier to understand, you can simply take an ordinary knife, put it to your neck today and feel how the blade touches your skin. That is a biological threat to your life and to the continuation of your lineage. But the fact that a friend offended you, or you didn't get paid at work, or something else happened, is not equivalent to this. And if you understand this, then the emotional component disappears and problems with erection no longer arise. Follow these recommendations, continue your lineage, and stay healthy.